Hello, my name is Kia Kinneber. I'm a physician assistant student at Morehouse School of Medicine. I will be performing a peripheral vascular exam as well as an abdominal exam on you today. Do you consent to that?
I do.
Okay. Can you confirm your name and date of birth for me?
Holly Higgins, Cooper, 82443.
Thank you so much, Miss Higgins. Do you mind if I call you that? Or Miss Cooper, do you mind if I call you that?
Please.
Okay. So the first thing I'm going to do, Miss Cooper, is wash my hands. And then I'm going to start with your peripheral vascular exam. So you're already laying down for me, so can you just put your hands at your side as if you're holding a bowl of soup? So have them up. Yes, ma'am. Thank you so much. And if it's uncomfortable, you can rest them in a comfortable position.
Thank you.
Thank you. Okay, so the first thing I'm going to do is examine your arms for normal color and to make sure that I don't see any protruding veins or any abnormal scarring. There's no abnormal scarring or protruding veins. So now I'm going to check for temperature. Temperature is normal, the skin is warm and dry. Okay, so the next thing I'm going to go on to is your pulse. So first I'm going to check your radial pulse. The pulse is regular. I'm going to check here. Pulse is regular. Next, and this was your radial pulse. Next, I'm going to check bilaterally for your brachial pulse. Pulse is regular. Pulse is regular. So while I'm up here at your arms, I'm going to go ahead and check for any edema. No pitting edema. I'm sorry. You can place your arm back to where it's comfortable. Here you go. And then I'm going to check here for any pitting edema above and below the wrist. No pitting edema, so no edema. The arms, your arms are normal. Next, I'm going to move to your legs. I'm going to roll up the patient's pants so that the legs are exposed. As I'm doing this, I'm going to be looking for normal color. I'm going to be checking for any evidence of edema or varicose veins. I do see some edema, but no varicose veins. So next, I'm going to check the for the popliteal pulse behind the knee here. Pulse is normal and regular. I'm going to check for the popliteal pulse here. The pulse is normal and regular. Next, I'm going to move to the posterior tibialis pulse here. Pulse is regular. Pulse is regular here as well. Do you consent to me taking off your socks?
I do.
Thank you. Okay, I'm going to be looking for any abnormal scarring as I remove the patient's socks. I don't see any abnormalities of the feet. I'm going to check the patient's pulse here, the dorsalis pedis pulse here between the great toe and the second toe. The pulse is normal. While I'm down here, I'm going to check at the lower tibial bone for any pitting edema. I don't see any pitting edema. I'm going to replace the patient's socks. This completes the peripheral vascular exam. And I'm going to move on to your abdomen. I'm going to drape the patient so that she's comfortable as I perform her abdominal exam. There you go. Do you consent to me pulling up your shirt?
I do.
Okay. Would you mind if I also pull down your pants just a little bit to expose your abdomen fully?
Fine.
Okay, thank you. So first, before I do anything, I am going to examine the patient's abdomen. I'm going to make sure that there's no abnormal bulging, no irregularities in shape or size. I'm going to check for any evidence of ascites, which would be any swelling, or medusa capitae, which is just swelling of the veins of your stomach. I don't see that. So next, I'm going to auscultate before I palpate. I'm going to be listening for bowel sounds. I don't want them to be hyperactive or hypoactive, which is making too much noise or making not enough noise. I just want normal active bowel sounds as I'm listening. So I'm going to first start by listening in the right upper quadrant. Normal active bowel sounds. Left upper quadrant. Normal active bowel sounds. Left lower quadrant. Right lower quadrant. Normal active bowel sounds in both. Now while I'm here, I'm going to go ahead and listen to the arteries of the abdomen. So first I'm going to start with the abdominal aorta. I don't hear any breweries, and I'm listening with the diaphragm of my stethoscope to these arteries. I'm going to listen to the renal artery here on the side. Then I'm going to listen to the renal artery here on this side. I'm going to listen to the iliac artery here on this side. And the iliac artery here down here. No bruise are heard in any of the arteries. I'm going to move on to the femoral artery. No bruise heard here. No bruise heard. Okay, so while I'm here, I'm going to feel for the inguinal lymph nodes over the clothes. If in a normal situation, I would be feeling underneath the clothes, but for this patient's comfort, I will be feeling above the clothes. The inguinal lymph nodes are normal, no swelling. Did you feel any pain or tenderness when I was palpating?
No, I did not.
Okay, wonderful. So now I'm going to move on to palpating the quadrants of the abdomen. So first, I'm going to do a light palpation. Do you feel any pain as I'm palpating here?
No.
Okay. And then I'm going to move to a deep palpation.
Okay.
Any pain?
No.
Great. All right, next I'm going to feel for your liver to feel for any hepatomegaly. So if you can just take a deep breath, I'll be performing the hook maneuver as I do so. Thank you so much. Thank you so much. And if you do the same thing, just breathe in and out as I perform the two-handed maneuver and feel for your spleen. I don't feel any hepatomegaly or splenomegaly as I'm palpating. Next, I'm going to go ahead and percuss the 4 quadrants of the abdomen. And I'm listening for any abnormal dullness or tympany. No abnormality. Now I'm going to palpate for the liver at the mid-sternal line. So I'm going to start from the bottom and palpate up. And I should hear tympany to dullness once I hit the liver. And then I want to hear dullness to resonance as I go up. And for the sake of this video, I will be percussing over the clothes, but normally you would percuss without a shirt on. So that was normal. The liver measured 4 to 8 centimeters at the mid-sternal line. If I were measuring at the mid-axillary line, the measurement of the liver would be 6 to 12 centimeters. So now I'm going to go ahead and palpate the spleen from the mid-axillary, from the anterior axillary to the mid-axillary line. And that's normal. Okay, so the last thing I'm going to do is have you sit up for me. Thank you so much. You can lay your legs over here. Great. And so what I'm going to do is go to the lower border of the 12th rib on each side, and I will be checking for CVA tenderness. Let me know if there's any pain when I hit my hand. Okay? All right. Any pain?
No.
Okay. Any pain?
No.
Wonderful. So no CVA tenderness. That concludes the abdominal exam and also the peripheral vascular exam. Thank you so much, Ms. Cooper. I really appreciate you for being my patient today.